Every 40 seconds, someone in the United States has a heart attack. And the difference between surviving with minimal damage and suffering devastating consequences often comes down to one thing: how quickly the person recognizes what's happening and calls for help. Here is what many people don't know. Heart attacks in older adults, and especially in women, often don't look the way they do in movies. There's no guarantee of crushing chest pain. The symptoms can be subtle, vague, and easy to dismiss. People wait, hours pass, and every minute of delay means more heart muscle lost. Today we're covering the full range of heart attack warning signs, including the ones most commonly missed, and what to do the moment you suspect one. This knowledge could save your life, or the life of someone you love. A heart attack occurs when blood flow to a section of the heart muscle is blocked, usually by a blood clot that forms on a ruptured arterial plaque. Without blood and the oxygen it carries, the heart muscle in that area begins to die within minutes. The heart is a muscle. Like any muscle, it needs a constant supply of oxygenated blood. The coronary arteries are the vessels that provide this. When one is blocked, the result is a myocardial infarction, a heart attack. Time is muscle. The phrase used in cardiology is telling. Every minute of blockage means more heart cells die. Rapid treatment, restoring blood flow, is the single most important factor in outcomes. That's why recognizing symptoms quickly is life-saving knowledge. Let's start with the classic warning signs most people know, but let's be specific. Chest discomfort. This is the most common symptom, but it's not always the sharp, crushing pain movies show. It can be a pressure, squeezing, fullness, tightness, or dull aching sensation in the center or left side of the chest. It may come and go. It may feel like indigestion or a heavy weight on the chest. It typically lasts more than a few minutes. Pain radiating to the arm, neck, jaw, or back. The pain or discomfort from a heart attack commonly travels, down the left arm most famously, but also to both arms, the upper back, the neck, the jaw, or the stomach. Any unexplained pain in these areas alongside other symptoms warrants immediate attention. Shortness of breath. Feeling suddenly breathless at rest or with minimal exertion, especially if this is new or different from your usual pattern, is a significant warning sign. It can occur with or without chest discomfort. Cold sweat, nausea, or lightheadedness. Suddenly breaking into a cold sweat, feeling nauseous, or feeling dizzy or faint, especially in combination with any other symptoms, can indicate a cardiac event. This section is critically important. Research consistently shows that women, older adults, and people with diabetes are more likely to experience atypical heart attack symptoms. And as a result, they are more likely to delay seeking help or to be dismissed when they do. Unusual fatigue. One of the most commonly reported symptoms in women who have had heart attacks is profound, unexplained fatigue, not the normal tiredness from activity, but an overwhelming exhaustion that can begin days or even weeks before the event. This is frequently dismissed as stress, aging, or poor sleep. Indigestion or heartburn that won't respond to antacids. Many heart attacks present as upper abdominal discomfort, pressure, or a burning sensation that feels exactly like heartburn or indigestion. If it doesn't respond to your usual antacid, or if it comes with other symptoms, take it seriously. Upper back pressure. A squeezing or pressure sensation across the upper back, between the shoulder blades, is more commonly reported in women than men. Palpitations or irregular heartbeat. A sudden feeling that the heart is racing, fluttering, or beating irregularly, particularly with dizziness or shortness of breath, can signal a cardiac event. Anxiety without clear cause. Some people describe a sudden feeling of doom or overwhelming anxiety, often alongside physical symptoms. The pattern to watch for is symptoms that are NEW, unexplained, and clustered together. Any combination of these symptoms, especially if they come on suddenly or are different from how you normally feel, demands immediate action. If you or someone with you experiences these symptoms, here is exactly what to do. Call 911 immediately. Do not drive yourself to the hospital. Do not wait to see if it passes. Do not call your doctor's office first and wait on hold. Call 911. Paramedics can begin treatment before you reach the hospital. This matters enormously for outcomes. Chew an aspirin if you have one available and you are not allergic to aspirin. A standard 325 mg aspirin or 4 baby aspirins, chewed rather than swallowed, can help prevent further clotting. Do this while waiting for the ambulance. SIT or LIE down in whatever position is most comfortable. Loosen any tight clothing. Try to stay calm and focus on breathing steadily. Unlock the door so paramedics can enter if you're alone. Do not eat or drink anything else. The most common reason people die from heart attacks they could have survived is that they waited too long. They convinced themselves it was probably nothing. They didn't want to be a bother. They drove themselves. Please, if in doubt, call. False alarms are infinitely better than the alternative. Knowing the warning signs is essential, but the best outcome is preventing a heart attack in the first place. The major modifiable risk factors are high blood pressure, high cholesterol, smoking, type 2 diabetes, excess weight, physical inactivity, poor diet, and chronic stress. Each one of these can be meaningfully addressed through lifestyle and, where appropriate, medication. Know your numbers. Blood pressure below 130/80. LDL cholesterol below 100. Blood glucose in the normal range. These are your early warning system, and regular monitoring gives you the chance to act before a crisis occurs. If you have a family history of heart disease, or if you've had a previous cardiac event, work closely with your doctor on a prevention plan that may include medications alongside lifestyle changes. The knowledge you have now could genuinely save a life, your own or someone you love. Heart attack symptoms are not always dramatic. They can be quiet, confusing, and easy to explain away. Don't explain them away. If something feels wrong in your chest, your arm, your jaw, your back, if you're suddenly breathless, sweaty, or overwhelmingly exhausted for no reason, act. Call 911. Fast treatment saves lives and preserves heart function. Please discuss your personal heart health risk with your doctor and make sure the people closest to you know these signs too. Take care of your heart. See you in the next video.